Hi, everybody, and welcome to this week's speaker series. This week we have Hannah from the Osteoporosis Canada Society, and she will be talking to us about all things to do with our bones with osteoporosis, as November is Osteoporosis Month. So, welcome, Hannah, and I will let you take it from here.
Thank you very much. I'll just share my screen here. So hopefully you can see the presentation now.
Yes, we can.
Perfect. All right. Thank you for having me today. So today I'm going to be talking about osteoporosis. I'm here as a volunteer with Osteoporosis Canada, and my name is Hannah. I'm also a Master's of Science student at Brock University. This will be about a 30 to 40-minute presentation, and I'll provide you some general information about the bone basics of osteoporosis. Please note that this information is not intended to replace medical advice, so please consult with your healthcare provider with any individual medical questions and to determine the best health plan for you. So before we begin, I'll ask that we save all questions till the end of the presentation, or you can use the chat box on Zoom to type in your questions as we go along, but I won't get to them until the end. So to start, I'll just let you know what Osteoporosis Canada does. So we're an organization that educates, empowers, and supports individuals and communities in the risk reduction and treatment of osteoporosis and osteoporotic fractures. Our Scientific Advisory Council is made up of experts who provide medical guidance and ensure that all our information is current and based on up-to-date research. In today's presentation, we're going to go over bone basics, fracture risk assessment, medication options, nutrition, exercise and movement, and falls and broken bones. So we will get started with the bone basics. So we like to start by reminding everyone that bone is a living and growing tissue. You'll note that there's some similarities between the structure of bone tissue and bridge supports. The combination of the protein framework and hardened minerals such as calcium and phosphorus give bone tissue flexibility as well as strength, similar to a bridge. You'll also note that there are two types of bone, so cortical bone, which is the dense, compact outer layer, and trabecular bone, which is like a honeycomb structure on the inside of the bone. The amount of bone tissue is called bone mass, and density refers to how compact a bone structure is. So since bone is living, it's constantly undergoing the remodeling process. This is how bone repairs itself. So osteoblasts are a type of cell that lay down protein in bone, and this protein is in the form of collagen. It becomes hardened by the minerals calcium and phosphorus as well as others, and this is how new bone is formed. Osteoclasts, on the other hand, break down bone, so they create this sort of cavity, and then it gets filled in by the osteoblasts, which build bone. So bone mass changes naturally with age. We start to lose bone at a rate of about 1% per year in our mid-30s. Then for females at menopause, this bone loss increases to 2 to 3% per year. In men, bone loss is slower until about age 65, and then it also increases. Bone loss, like I said, is natural, but it can reach a point where fracture risk increases, and then this is not good and leads to osteoporosis. So as you can see, we reach a peak bone mass at about age 30. So up until this point, what you eat and how you exercise impacts the bones that you build. And so this is why we say that osteoporosis is a pediatric disease that shows up in older age, because everything we do up until that point affects how much bone mass we have. So yeah, as I mentioned there's our peak bone mass around age 30. So next I'll talk about the definition of osteoporosis. It's a disease characterized by low bone mass and deterioration of bone tissue, which can lead to increased risk of fracture. It's important to differentiate between osteoporosis and osteoarthritis. These often get mixed up. Osteoporosis is a disease of the bone, whereas arthritis is a disease of the joints and surrounding tissue. An accurate diagnosis is important for pain management and treatment of the disease. So today we'll be talking about osteoporosis, not osteoarthritis. So as I mentioned before, this is what the trabeculae, or the inside part of the bone, looks like. So you'll see the normal one there, and then with osteoporosis, you see the more porous bones. So this one is less supportive, it's less dense. The crosslinks are fewer and far between, and so this bone is more fragile, and this is what causes an increased risk of fracture. Osteoporosis is often called the silent thief because there are no symptoms associated with the deterioration of bone tissue until a fracture occurs. There are two types of osteoporosis. So primary osteoporosis is used to describe the abnormally rapid bone loss that can occur after menopause or as we age. Then secondary osteoporosis refers to bone loss caused by other diseases or drug treatments and can affect a person at any time during his or her life. One class of drugs that has been shown to be particularly damaging to bone is glucocorticoids, such as prednisone. Diseases often treated by glucocorticoids include colitis, multiple sclerosis, rheumatoid arthritis, and lupus. Medical conditions that can cause bone loss include Crohn's disease, colitis, and chronic kidney or liver disease. So those are some of the things that can cause secondary osteoporosis. With both types of osteoporosis, there are 4 common sites of fracture. So these are the wrist, the spine, the hip, and the shoulder or upper arm. Skull, hand, ankle, and foot fractures are not typically associated with osteoporosis. Over 80% of all fractures after age 50 are caused by osteoporosis. And the reason why these fractures occur at these 4 sites is that these sites are rich in that honeycomb trabecular bone we saw in the earlier slide. So the trabecular bone is sensitive to calcium loss with age and at menopause, making these sites more susceptible to osteoporotic fractures. So it's also important to remember here, bone loss doesn't hurt. The first sign of osteoporosis is usually a fracture. So fragility fractures are broken bones that happen spontaneously or as a result of normal daily activities or falls from standing height or less. It's not normal to break a bone from a minor fall, and it may be a sign of osteoporosis. Fragility fractures should trigger a bone mineral density test, as this can help to determine if it's osteoporosis. So a fragility fracture can happen with something as simple as slipping or tripping or standing from a falling height or less. It could also be from something like bending down to pick up an object, making a bed, or coughing and sneezing. A fracture in one of these instances isn't typical and could be a sign of osteoporosis. And a fracture is one of the most significant risk factors for predicting future fractures. So this is why it's important to get that checked out so we can try and prevent future fractures. So wrist fractures are the most common type of fragility fracture in women under 75. And so this might not seem like something serious, but it can be. These fractures are a sign that the individual may have osteoporosis, and one osteoporotic fracture means you're more likely to have another. So even if it's something as simple as a wrist fracture, that's why we just want to be extra cautious and get that checked out with a bone mineral density test. So another type of fracture are spinal fractures. These are also sometimes called compression fractures, and they can result in height loss, back pain, sleep disturbance, depression, protruding abdomen, digestive disorders, trouble breathing, and impaired activities of daily living. Spinal fractures can be very painful, but sometimes they also cause no pain at all and go unnoticed. They could also be mistaken for a pulled muscle or just a backache. 2/3 of spinal fractures are painless and therefore go undetected. because these fractures result in the vertebrae in your spine collapsing or crushing, individuals lose height. So this is why height loss is a good way to measure and check for spinal fractures. If a fracture does not cause severe pain, height loss caused by the fractures should trigger an assessment for osteoporosis. So how much height loss is not good? So for all men and women over 50, it's recommended to have annual height measurements. If you have lost 3/4 of an inch in 1 year, or if you have lost 2 centimeters within the past year, or 6 centimeters overall since the time you were a young adult, this should trigger a spinal X-ray and an assessment for osteoporosis. Another type of fracture is hip fractures. So the consequences of not being diagnosed with hip fractures can be really devastating, because about 1 in 3 hip fracture patients will suffer another fracture within 1 year. After a spinal fracture, the risk of suffering a second spinal fracture is 20%. After a wrist fracture, it's only 14% of people who will suffer a fracture in another year. So for hip fractures, it's a lot higher. 40% of people who fracture a hip had a prior non-hip fracture, which was not recognized as a warning sign for osteoporosis. If osteoporosis was identified when a wrist was broken, for example, it's very likely that treatment with effective medications would prevent many hip fractures. So how high is the rate of osteoporosis? Well, 1 in 3 women and 1 in 5 men will have an osteoporotic or fragility fracture in their lifetime. These fractures are more common than heart attack, stroke, and breast cancer combined. We also like to mention men with osteoporosis. It's often thought that osteoporosis is a woman's disease, but men also get it, not as frequently as women. But the issue is when men do get it, it's substantially underreported and underdiagnosed and undertreated. Fewer than 10% of men with fragility fractures receive osteoporotic therapy. And over a quarter of hip fractures in Canada occur in men. A man is more likely than a woman to die of complications following a hip fracture. So this is why we want to let you know this presentation is for men too, not just women. All right, so that was a lot of information, but that was our bone basics. So now we'll get more into some of the things that you can do. We'll start with fracture risk assessment. So as I mentioned before, bone mineral density tests can help identify people at risk for osteoporosis. So it's recommended that all women and men over 65 should get a bone mineral density or BMD test. Postmenopausal women and men between 50 and 64 who are at risk of fracture should also receive these tests. So some examples of risk factors are having a fragility fracture after age 40, high alcohol intake, a parental hip fracture, being a current smoker, having a low body weight, or being on one of the high-risk medications I mentioned earlier. And again, you don't need to memorize all these things. You can always talk with your healthcare provider if you're concerned. And for younger men or women who are under 50, if you have a disease or condition associated with low bone mass or loss, then you may also want to get a bone mineral density test. So one other way that we look at fracture risk assessment is a 10-year fracture risk assessment. So those bone mineral density tests are good. There's some other factors that can contribute to people's fracture risk. Your healthcare practitioner now will conduct a comprehensive 10-year fracture risk assessment, and it will look at the bone mineral density test results combined with your age, sex, your history of fragility fractures, and some other risk factors as well. This assessment gives a more accurate prediction of fracture risk and will divide patients into one of 3 categories, so low, moderate, or high risk. Then, based on that assessment, they will decide if you need medication and if you need, or how often you need, a bone mineral density test. So for people at high risk, for example, they should get medication and repeat bone mineral density tests every 1 to 3 years. If you're low risk, you likely would not receive medication. And if there was no additional risk factors, a testing interval of 5 to 10 years for those bone mineral density tests would be sufficient. So next we'll talk about medication for osteoporosis. So the goals of medication are to reduce fracture risk, prevent further bone loss, and increase bone mass. Remember me talking about those osteoclast and osteoblast cells? Well, this is how the medication works. It affects those cells, and so it can either slow down the breakdown of your bone or speed up the building process. We always recommend to discuss with your doctor which medication will be best for you. So how will you know if your medication is working? As we mentioned, you won't feel any different. Bone loss doesn't hurt or doesn't feel like anything. However, they'll know it's working if your bone density remains the same or increases and no new fractures have occurred. So your doctor will monitor it through bone mineral density tests. It's important to know that even though you may not feel anything, discontinuing medication may result in bone loss. People respond differently to different medications, so this is why we recommend speaking with your doctor. But it's important to know that all medications reduce the risk of vertebral fractures from 30 to 70%. And for high-risk individuals, the benefits of drug therapy far outweigh potential risks. All right, so next we'll talk about nutrition, and then we'll talk about exercise. So these are the parts of the presentation that I find people find the most helpful. So things that you can do on your own to help prevent osteoporosis. So as I mentioned before, our bone is a living tissue, and healthy food choices are essential to build and maintain the best bones for our bodies. There are 3 key nutrients important for bone health throughout the life cycle. So calcium is one of the key minerals that make bone hard. Vitamin D ensures the body can absorb enough calcium from the gut, and protein is essential to build and maintain collagen in bone. So this is important for your bone to be able to grow, maintenance, and fracture healing. So we'll start with calcium. Calcium has many roles throughout your body. It's found in cells, in blood, in your bones, of course, and teeth. Bone is the place where the body stores most of the calcium. So 99% of the body's calcium is found in bones and teeth. If there's not enough calcium in our diets, then our body has to take calcium from bone. When this happens, our bones become more fragile. So for example, your body might have to remove calcium from the bone so it can use that calcium for other life-sustaining functions in your body, and we don't want that. So that's why it's important to consume enough calcium in your diet. So as you can see here, we have the daily calcium requirements recommended for different age groups. So for people over 50, 1,200 milligrams is recommended. So Osteoporosis Canada strongly recommends obtaining calcium from food sources whenever possible. I'll talk about supplements after, but just keep that in mind. It's definitely better to try and get your calcium from food sources. It's important to eat a well-rounded diet with adequate calcium and protein. If your diet is not giving you enough calcium, do not take extra in supplements. It's important to figure out how much calcium you're getting before you decide to take a supplement. So how do we calculate how much calcium we're taking? So I mentioned before that it's recommended to get 1,200 milligrams per day for people over 50. So you can give yourself a baseline of 300 milligrams of calcium simply for eating. There's small amounts of calcium in a variety of the foods that we eat. Then you can add more calcium depending on your food choices. So for example, you can add 300 milligrams for any of the following foods: a cup of milk, a cup of fortified soy, rice, or almond beverage, a cup of fortified orange juice, about 3/4 of a cup of yogurt, or half a cup of salmon with the bones in. And that's something that's quite controversial when we do these presentations. Some people really don't like having those bones in their salmon, but if you can do it, we recommend it. It is good for your bones. I will also pass along a link for the nutrition section of our website, so osteoporosis.ca, and this is where you can access a calcium calculator and get more information. As I mentioned, calcium supplements are also available. It's really important to not overconsume calcium from supplements. It's important to know how much calcium you're consuming before deciding on a supplement. And if you are going to take a supplement, space them out throughout your day to provide the bones with a constant source of building material. It's important to not take more than 500 milligrams at one time and take the supplements with lots of water. Calcium carbonate must be taken with food. So this is just one type of calcium supplement. Calcium citrate can be taken on an empty stomach. So it's important to look at those labels and make sure you're taking the supplement the way it's meant to be taken. If you can't get enough calcium from food, Osteoporosis Canada recommends taking a supplement, but only after consultation with your doctor. You don't want to consume too much calcium. Having more in your body than it is able to use doesn't benefit you. So the next nutrient we'll talk about is vitamin D. There are very few natural sources of vitamin D, so Osteoporosis Canada recommends daily vitamin D supplementation year-round for adults over 19 years of age. Vitamin D helps us to build stronger bones by increasing the absorption of calcium. It improves the function of muscles, which will improve balance and help prevent falls. So as you can see here, we have some daily recommended intakes for different age groups again. So for men and women over 50, it's recommended to take 800 to 2,000 IUs, and that just stands for international units of calcium a day. And supplements, again, will be labeled this way. And some of them I know are in tablets or in liquid form in drops. So there's different ways you can take those. Vitamin D, is, as I mentioned, recommended year-round as a daily supplement. The final nutrient we'll talk about is protein. So in addition to calcium and other minerals, bone is made up of protein. It's essential for bone strength and flexibility. It aids in fracture healing and helps repair body tissue. It also helps maintain muscle tissue, which is important for mobility and to prevent falling. It's recommended to eat a protein-rich food at every meal. So some good sources of protein are beans or legumes, eggs, and of course, fish and other meats. So how much is a serving of protein? Well, for meats and alternatives, it's about the size of a deck of cards. And so, as I mentioned, 2 to 3 portions is recommended a day, or one protein-rich food at each meal. You want this spread throughout the day again, just like the calcium. And another great source of protein are milk and alternatives. And again, it's recommended to take 2 to 3 portions daily, and you're kind of killing 2 birds with 1 stone with this one, as you will also get calcium from these dairy products. An example of a serving is 1 glass of milk. All right, so that was the diet section. Next, we'll talk about exercise and movement, and then we'll finish up with fall prevention. So People with osteoporosis and those at risk of developing it can help to prevent bone loss, fractures, and falls by combining specific types of exercises. Walking is not enough. An exercise routine should include strength training, posture training, balance training, and weight-bearing aerobic activity. Benefits of exercise include improvement to muscle mass and strength, fall prevention, and reduction of spinal fractures. So the first component we'll talk about is strength training. This involves using muscles to generate force against resistance. It's recommended to be done at least twice a week, and you should do one exercise for each major muscle group. So these groups are the lower legs, your upper legs, chest, back, arms, and shoulders. You can use free weights, weight training machines. Most of us are probably at home because of COVID, so it's definitely doable from home as well. You can use things like exercise bands or even just lifting your body weight. For example, doing a push-up on a wall or a counter or a squat. So other examples to try at home, slowly lowering yourself down into chairs instead of flopping down, doing some calf raises while you're standing and brushing your teeth. Little things like that that you can add into your day are recommended. Remember that you must know your fracture risk category before you start an exercise program. If possible, people are advised to consult a bone fit trained exercise specialist to determine what's appropriate for them. And we do have some resources for that on our websites that I'll share at the end of the presentation. So next is postural training. So there are many exercises that work on our back and abdominal area and shoulders, and these will help maintain good posture. Again, it's recommended to seek advice from a bone fit specialist or physical therapist. So for good posture, it's recommended to check regularly that you're standing with good posture by reminding yourself of the following things. So balance your weight evenly on both feet, gently draw your belly in, keep your gaze straight, gently tuck in your chin, and draw your breastbone up slightly. It's recommended to do this daily. So I have a little activity for you if you're sitting or standing at home. If you're sitting, just sit up nice and tall. If you're standing, you can follow along too. So pretend you have a string attached to the top of your head and you are pulling that string up, lengthening your spine. So think about doing that, and then think about gently drawing the belly in. Bring your belly button towards your spine and keep your gaze looking straight ahead. Gently push your chin back with your fingers and lift your breastbone like you're showing off a beautiful necklace. So when you think about those things, that can really help to work those posture muscles, which can help. So now you can relax. We'll talk about balance training next. So balance training exercises help to improve your balance and coordination. So this is important to help reduce falls and fractures. It's recommended to perform balance exercises daily. You can find classes in your community or online because of COVID that include balance exercises, or you can you can get help from something like your bone fit specialist or a physical therapist to help select the right exercises for you. It's important to increase the difficulty and intensity of your balance exercises over time. So some good examples are taking up activities like Tai Chi or yoga or dancing. Some simple things you can do at home: do heel raises while you're waiting for your tea or brushing your teeth, walk heel to toe every time you go to the bathroom. And these are ways you can just incorporate some balance training into your regular daily routine. It's also important to note to observe safety precautions when doing balance activities, such as having a wall or a table or a chair nearby to hold on to. The key is to do the balance training daily and pick an exercise that is a little bit challenging, but not so challenging that you're likely to fall. So the last component of exercise we'll talk about is weight-bearing aerobic physical activity. This is most beneficial because your bones and muscles are working against the force of gravity. So things like swimming or biking, your body is not carrying your weight, the water or the bike is. If you like swimming and biking, we definitely recommend to keep doing that, but you should try and incorporate some weight-bearing activity 1 or 2 times a week as well. So we should all aim to get our bodies moving and our hearts pumping at least 30 minutes every day. It's okay to break it up throughout the day into 10-minute bouts. You'll know you're working hard enough when you're breathing heavier and your heart is pumping faster. If you can talk while doing the exercise but not sing, you're probably at a moderate intensity. If you can't talk without stopping to catch your breath, you're exercising at a vigorous intensity. If you're at high risk of fracture, it's recommended to stick to moderate intensity. So some good examples are things like walking, dancing, step aerobics, different things like that. Finally, we'll just end the exercise section with some bone health precautions. So if you do have osteoporosis or at high risk, you want to avoid movements that involve rapid, repetitive, weighted or end range, forward bending or twisting of the spine, especially if you're at high risk of a spine fracture. So what I mean by end range, forward bending, so you don't want to be going all the way to where you can't go any further. That would be the end of your range of motion. So some tips: step to turn instead of twisting your spine, avoid lifting from or lowering to the floor, slow controlled twists, and as I mentioned, not to the end range of motion, so not to the point where you can't go any further. You want to hold the weight close to your body and don't ever hold it over your head. You can always consult with a physical therapist or an occupational therapist to learn how to perform daily activities safely. And as I mentioned, we have some resources on our website. So this is one of them. It's called Too Fit to Fracture, and it's a series of exercise recommendations for people with osteoporosis or spine fractures. All right, so the final section is falls and broken bones. So falling is serious. 1 in 3 adults over age 65 fall each year, and 1 in 2 adults over the age of 80. Those who have fallen once have a greater chance of falling later, and approximately 95% of hip fractures in people over 65 years of age are a result of a fall. Falls are a significant cause of death and disability and can have a serious impact on the psychological and physical health of older adults. These injuries include hip fractures, head and brain injuries, sprains, broken wrists and ankles. Injuries from falls are one of the leading causes of admittance into nursing homes. And in addition to the financial cost of hospitalization, the loss of independence can be really devastating. So this is why we want to help you to not fall. So this here is the fall cycle. And basically what it's showing you is that if you have a history of falls, this is one of the best predictors of a future fall. So what can happen is when someone falls, and they get really nervous about it. So if your normal caution turns into an extreme fear of falling, feelings of fear and helplessness can be really stressful and emotional. And this fear might also cause decreased activity, so down there in the yellow. And when you have decreased activity, this can result in loss of strength and mobility, which then can result in an increased risk of falling. And then if you fall and it increases your fear of falling again, you can see how this is a cycle. So if you have fallen and you feel like you're in this cycle, you need to identify where you are and try and figure out how to break it. And this can be with the help of other individuals. You don't have to do it on your own. So the last thing I want to leave you with is just some fall prevention tips. So number 1, have your hearing and vision checked. Sometimes adjusting to a new pair of glasses, bifocals or trifocals can cause people to be unstable. But ultimately, if you have good vision and hearing, this can help to prevent falls. So it's important to address that with your doctor. 2 is have medications reviewed. So it's important to know why you're on each medication and what it does. Have your blood pressure checked. Many people have a blood pressure cuff at home now, or you can go to a pharmacy and have it checked. Take better care of your feet and review footwear. So keep your toenails trimmed, wear shoes with good support. Slippers are called slippers for a reason. Supportive footwear can really help to prevent falls. Next is participate in regular exercise, and this should include balance exercises. This will help prevent falls, of course. Eat well. A balanced diet is important, and staying hydrated. Review your calcium and vitamin D intake and make sure you're getting enough of both of those nutrients. Review your home for safety hazards. Wrinkled carpets or throw rugs can be an issue. Pick up clutter from the floor. Night lights in your hallways and in the bathroom are recommended. And also keep in mind that while pets are great company, they can also be a tripping hazard. So this is just something to be aware of. Next is learn more about the equipment for home independence and safety. We like to remind everyone that it's good to shift our thinking from canes and walkers. Don't make us look old. They help us to stay independent for longer. So finally, this was the end of the presentation. So if you would like some more support, you can definitely reach out to us at info@osteoporosis.ca. We also have a phone number available if you want to call and talk to someone to get more information. And finally, as I mentioned a few times, we have our website, so osteoporosis.ca. You can subscribe to our Unbreakable newsletter on there. You can take a quiz to learn about your osteoporosis risk. There's a calcium calculator, our exercise resources as well. And there's also an information line, so if you don't have computer or access to internet, they can help you out on the phone as well. And that is all for my presentation. Thank you for having me.
Excellent. Thank you very much, Hannah. That's been very informative and interesting. We appreciate you coming and joining us. And thank you to everybody who's been watching, and have a great day. Thank you.